Students, so today we are going to discuss November Aiims 2019 question. One of the questions which was asked this year was that patient suffering from psoriasis since last 5 years. The psoriatic plaque responded to steroids, but on withdrawal, patient presented with such first pus-filled lesions as shown in the image. What is your diagnosis? So looking at this question, we already know that the patient is suffering from psoriasis. So it might be a complication of psoriasis which might have occurred, and since the patient is taking steroids, and we know that steroids are anti-inflammatory drugs, so what they do, they reduce the inflammation, so the psoriatic plaques also respond. But what happens once we withdraw these steroids? Once we withdraw these steroids, what happens? Rebound phenomena occurs and more severe type of psoriasis occurs, which might lead to such pus-filled lesions. So probably this is a case of pustular psoriasis, because majority of the cases of pustular psoriasis, they occur on the withdrawal of steroids or after application of some contact irritants like diethrenol. So in the image you can see these pus-filled lesions are present, but remember that this pus is not infective pus. This is not infective condition. This is pus-filled lesions which are formed in psoriasis, and these pus-filled lesions have pus which is sterile. So these are sterile pustules of pustular psoriasis. If you look at other options, we can exclude them out very easily, because one of the option is staphylococcal scalded-skin syndrome. Now all of you know that staphylococcal scalded-skin syndrome is also known as Ritter disease or pemphigus neonatorum. So in this condition, what happens? Actually, a neonate, a young child, is having severe staph infection, and this staph releases exfoliative toxins, and these toxins, they go and destroy desmoglein 1, and we all know that desmoglein is present in desmosomes which help in attachment of the keratinocytes. So once desmoglein 1 is destroyed, what happens? The keratinocytes start separating, and due to this separation, what happens? That exfoliation occurs or epidermal separation occurs. So this epidermal separation which occurs due to this staph infection is seen in young children, neonates, and this is known as pemphigus neonatorum. So there is no role of psoriasis here, and such clinical history is also not mentioned. So obviously this is not the answer. You might consider that patient is taking steroids, and that's why patient had developed secondary infection, that is pyoderma. But remember that this pyoderma is generally localized to one specific site where the infection might have occurred, but here generalized pustules are developing over the psoriatic lesion. So this is more pointing towards pustular psoriasis rather than just infective pyoderma. So this is not pyoderma. There is one more condition, that is subcorneal pustular dermatosis. Subcorneal pustular dermatosis is a type of IgA pemphigus. So this is a type of IgA pemphigus, and again you can see that it has nothing to do with psoriasis, where such long history of psoriasis and withdrawal of steroid is mentioned. So all these are pointing towards pustular psoriasis. So answer here is pustular psoriasis.